I've been looking forward to this, and I've been thinking about what to talk to you about. And I've come up with the idea of aging, generations, and medicine. And so we're going to do a little bit of history, a little bit of art, a little social behavioral determinants of functions and structures of medical society. And I do have slides, so I will be sharing those with you. This painting that you see here is called The Doctor, and it was commissioned and painted in 1890 by the artist Luc Fildes. At the time, it was not unusual for very wealthy patrons to commission artwork. And Sir Henry Tate commissioned this one, and he gave Luc Fildes a pretty broad spectrum of paint something that's of interest to you. Well, Fildes decided to recall a personal tragedy of his own in this painting. And it was when his son, his first son, Philip, died at the age of 1 in their Kensington home, shown here. So he never forgot the doctor who came to their home every day to meet with the mother, his wife, and Fildes, and to observe the child. Now, the painting itself, shown here, became quite famous and put on record the status of the doctor of the time. The time is the end of the 1890s. And this was discussed in the Times in March 1891. Let's look a little bit more closely at the painting. There's a lot shown here. The actual focus of the painting is on the face of the doctor, who's dressed well in a tailored suit. He's sitting beside a fairly makeshift bed, 2 chairs put together, some pillows, and the child is laying there, seemingly not totally conscious, the arm falling over the edge of the pillow. And the doctor has a compassionate look on his face. He's looking at the child intently, leaning towards the child. And in the background, we see, and it's hard to see because the focus again is on the physician, is Fildes himself standing behind the chairs, gazing upon the doctor. And his wife, with her head in her arms and her hands clasped as if in prayer. And of course, waiting for the doctor to say something. This painting created the persona of the professional devotion of a caregiver. And in fact, when it was launched, it was exhibited at the Royal Academy and immediately sold over 1 million copies, many to physicians who hung the paintings in their offices. This you will see frequently in medical schools and sometimes still in hospitals and doctors' offices. And it really created this phenotype of what a physician should be. But let's take a minute to look at this picture. The physician really in 1891 had very little to offer that young patient who was dying of something pretty simple, pneumonia. There were no antibiotics, no vaccines. Germ theory wasn't really well known. I'm sure the doctor didn't wash his hands. And yet, this is what we view the doctor bringing to the bedside: compassion, hope. And of course, that's so important to the patient and their loved ones. So what's the next artwork that I want to show you is the Country Doctor. And this appeared in Life magazine in 1948. Now, this is about 50 years after Fildes' The Doctor. And in this picture of a country doctor in Colorado, the doctor himself is a real person. This is a photograph, the author from Life magazine shadowed this doctor for 23 days and was fascinated with what the doctor did. He, as he said, captured the drama of the everyday events that this physician did and cared for, and felt the extraordinary intimacy of the doctor with the patient. And as this was published, this became a new benchmark for photojournalism in the 40s and 50s, a very popular Life magazine, and was also frequently kept in doctors' offices of the time. Now, there's a little difference here. Now, both these doctors, Fildez is the doctor and the country doctor, are both wearing suits and well-groomed. This doctor seems to be striding purposefully along to, I'm sure, a house visit at the time to visit a patient. And in his hands, in 1948, is a black bag, pretty large black bag. This doctor has some tools that were developed over the prior 50 years that he could carry to the patient he was going to visit. So as we look at these doctors and the evolution of care and what this doctor could do compared to the doctor in Fildez's portrait, I want to go over how we got to medicine in 2021, how we achieved what we're doing today, and how we're looking to the future. And I want to do that by looking at the past. So the past is not that long a past. It's really about 100 years. Medicine as we know it really evolved over the last 100 years. And really, the golden age of medicine is described to begin in 1930. Prior to that, in the early 1900s, medicine was non-scientific, anecdotal, unregulated. Actually, the United States had so many medical schools, they were unregulated. Physicians were graduated or given certificates. There were no qualifications. It was a disaster. There was no way to reform medical education, and so a group of educators and practitioners came together because of the poor medical education and the lack of qualifications of many caregivers of the time to form the American Medical Association in 1847. That was the primary role of AMA, medical education, qualifications of physicians for the good care of the patient. They were pretty unsuccessful. They worked pretty hard at this, but were unable to do medical reform. They went to the Carnegie Foundation. The Carnegies were interested in advancing teaching, and the AMA with the Carnegie Foundation hired a very important man. His name was Abraham Flexner. And Flexner in 1910 published a report on the poor function of medical education in the United States. And more important than condemning the commercialism and the poor education, he put forth a plan for what medical education should be. So based on his plan, most of the commercial schools were destroyed over the period of 1910 to 1920. So by the time of 1930, medical education was a scientifically based university discipline. And that began the golden age. Now, in parallel with this, a group of physicians, a small group of physicians who happened to be researchers as well, came together in the home of a private practitioner. His name was Robert Eads. His dear friend was William Osler from Penn. 4 physicians came together and they formed the Association of American Physicians in 1886. That small group, together with the Flexner Report, reformed medical education and introduced the idea that to drive patient care, we needed to do research. Pathology, biology, chemistry, all came together for rapid advances over the next years. The molecular age, as DNA structure in 1950s came about. It wasn't, though, just these societies and these doctors and reform of education. There were other key things happening in the world, and particularly in the United States, that allowed all this to evolve to great medical care. And it was that in the last century, we saw a rapid advance, the industrial age, early 1900s, the atomic and space age through the 40s and 1980s. Finally, now the digital age. We had the development of electricity, gasoline, combustion engine, telephone, travel by rail, highways, then air. We could be connected nationally, internationally. That allowed researchers to talk to one another, publish papers, read them, apply the findings to patients, convene meetings. The Association of American Physicians had their first meeting together. And so in this way, medical sciences advanced with medical education. This golden age of medicine continues. The breakthroughs that we now have at our fingertips, our understanding of germ theory, the creation of antibiotics, widespread vaccinations, advances in public health, understanding dysentery, sanitation. This led to longer lifespan. So in the 1900s, before the Flexner Report, the average age of men and women were in the mid-40s. 1940, when the flu vaccine became available, and 1945 was when penicillin was widely available, men and women lived to be around 60 years old, as compared to 2018, average age in the 80s until death for men and women. And it's predicted by 2050 that we will live to be over 120 years old. This is because we've conquered, for the most part, many infectious diseases and prevented others, including cancer. As we look at this and you think, well, people are getting older. Are they getting old? What's happening to aging? What are the generations doing? This is interesting to me. As I get older, and I think, what is the future going to hold for me? Well, first of all, the whole world is getting older. This is an interesting graph published by the United Nations. If you look at the y-axis, it shows the percent of people of the population of the world. And this is between 1950 to 2050. Now, some of this is extrapolated out, but the earlier numbers are based on census data. If you start from 1950 and you move forward to 2021, where we are now, you can see the red line with people under the age of 5 in red, and blue with people the age 65 and older. And what do you see? The percent of people that are under 5 is becoming less of a percent of the global population, while those over 65 are increasing. As we live longer, we don't die, the population accumulates older people, and in 2021, we've passed. So people over 65 now outnumber children under 5. Now, as we have an aging population in the world, what does this mean? Are we really older? And I ask that because there's some questions about this, that as we all get older, we don't get old. Populations aging has slowed down. Sounds paradoxical. It's not. The longer you live, the healthier you are. In fact, improvements in life expectancy mean that when you turn 65, you're really not old. Age is not a chronological age, it's a biologic age. And the way that most epidemiologists are looking at aging now is we should really look at old as being when you have less than 15 years left in your lifespan, a prospective age, meaning that middle age lasts a lot longer. And as we get older and older, and the population percent has older people, the proportion of people who are truly biologically old falls. What does this mean? Well, we're not dying usually of acute illnesses. We have antibiotics now. Remember the child in Phil Dez's portrait? He was dying of a pneumonia, no antibiotics. But it means we have a larger cohort of people that require care for chronic diseases. And over the last 100 years, particularly in the last 50 years, doctors have become more involved in treatment of chronic disease as compared to acute disease. Think about your own practice. And of course, cancer care. Now, I'm a researcher, a physician scientist, and one of the things that concerns researchers over the last years at the National Institutes of Health, and this is a paper published in the Proceedings of the National Academy of Sciences, is that, geez, people who are getting grants are getting older, and you are older at the time of the first grant that you receive. There was a review done of this in PNAS by Mike Lauer, the deputy director of the NIH, and this graph shows the percent of funded investigators on the y-axis, and on the x is years. And you can see that the age groups of 46 to 60, age less than 45, and age greater than 60 are represented by different color lines. And it shows that the proportion of people getting grants that are over 60 is increasing. And this paper only went to 2015. It continues to rise. And those under the age of 45 that are getting funded are less and less and less. But that makes sense if you recognize the whole world is getting older, and perhaps middle age is expanding, and perhaps youth is getting older too. Well, it's not just those doing research. This is a snapshot by the healthcare industry of all the physicians in the United States. We're all getting older. In fact, 1 in 4 doctors in the United States is over 65 years old. These are practicing physicians. 42% of physicians are over 55. They don't want to retire. And I'm a lung doctor. And if you look at the bottom of this figure, pulmonology, you can see we happen to be the oldest people specialty. 73% of us are over 55. Why are there so many older physicians? Why are they not retiring? The survey that was done by the Mayo Clinic actually published that, in fact, those doctors who have the best satisfaction in their work are those that are older. And they found it fascinating that the psychological construct of an older physician was one of optimism and a purpose in their life. It's not just physicians that are getting older and aging successfully, but scientists in general. And this is one on the engineering workforce, which is also aging. In this Proceedings of National Academy of Sciences paper, it also shows that scientists are disproportionately increasing in age as compared to the general population, more so than physicians. And this is due to a decline in the retirement rate. Again, PhDs, MDs, doctoral individuals are not retiring. They seem to be satisfied in their work. So many of you may be around my age, and I'll ask a few questions that may define our age cohort. Are you devoted to your work? Do you aim for very high achievement, perhaps to the exclusion of leisure activities? When you think of retirement, do you wonder, what else would I do? Well, that defines a certain cohort of people. Those people are called baby boomers. And this is where age becomes wrapped in generational ages. And I'll tell you about how generations impact behavior and lifestyle. And many of you may know this already. Layering above the golden age of medicine are these cohorts of populations that were born in periods of time that allowed them to experience the world and major events in the world that shaped their way of thinking and living. The greatest generation before the 1930s, The silent generation, born between 1933 and 1945. Baby boomers, born between 1946 and 1964. Generation X, born between 1965 and 79. Then we have the millennials, like my daughters. And finally, Generation Z, the new generation being born since 1996. The generation that was first impacted by the golden age of medicine were the baby boomers. They delighted in all the health care that was made available for them as a child. Many of you, if you are a baby boomer, remember getting a shot of penicillin in the buttocks. I do. You remember getting your vaccines lined up in school with the nurse? And these were things that we took for granted that allowed our lifespans to expand, to get older, but not to age, to feel middle-aged, so that your 60s, you feel like you're in your 40s. And so this idea of generational age is very important, not just to understanding the past as we see it, but to think about the future and what is to come. The fact is that baby boomers are going to be here for a while longer. And what does a baby boomer life? What do they recall? I want to go over this with you because it is my memories. I'm a baby boomer, and I want to tell you what I've experienced and how it's going to look different as we look to the future for Generation Z, or the millennial generation. Well, when I was a little girl, I remember the first TV my mom and dad purchased, and my dad carrying it into the living room. I remember sitting about 5 inches from that TV. It was a black and white. I remember the first radio, a transistor radio, putting it right up next to my ear. Didn't have many channels, was hard to tune. I used a slide rule. I used a typewriter, and did quite well with those things all through high school and even into college. My first calculator was in 1977. Maybe some of you recall this. It was very expensive. I saved up for it, and it was revolutionary for me. It was hundreds of dollars, and it didn't do very much. Texas Instrument, personal computer. This was 1980s, and I think most of us of this generation remember the first personal computer, whether it was a PC or a Mac. And again, it couldn't do much, came with a floppy drive. Maybe you could do some word processing, something called WordPerfect. A little bit of numerics, but not much. And it was wonderful. It moved us away from the typewriter. We got away from the slide rule. We were becoming digital. This is important to me. Can you imagine a world without a microwave? 1989, microwaves came into being. Changed the world for us to get home and make dinner quickly. 1990 was the internet. And I was on the internet very early because I was at the National Institutes of Health. And I remember moving away from the NIH to Pittsburgh and realizing not everybody could communicate through this World Wide Web. And other people did not have an email address. Seems very long ago, but it was only 1990. Email in 1992, and then the cell phone. And I don't think there's probably a person in the room that doesn't have at least one cell phone, maybe two. You might have a private and a worky cell phone. And then, of course, the social network that expanded all of our friends, and the iPhone, which I'm particularly fond of. And then here we go. It comes into medicine. The digitalization of the electronic health record. And that has changed our lives too. So you have this entire lifespan, which seems to go from prehistoric age to complete digitalization of our lives. And of course, as a physician researcher, the explosion of big data, how to handle it, how to do science in this digital age. So this was my experience. And I feel that it affects how I do my work and how I can see the future. What about this young child that was just recently born? Generation Z. This child, unlike me, will never know a world without a phone, without a digital device. I had to go to the library, card catalog, looking things up in the back stacks of books. This child won't ever know a library like that with a lot of books in it. It makes me a little sad. This child will be in a world where it won't know what it is to not know, because they can quickly do an internet search and find lots of information at their fingertip. How are they going to view the world? How will they live in the world? How will they take care of patients? Seems a far cry from Phil Dez's doctor at the bedside, or even the Life magazine country doctor. Well, we know a few things about this Generation Z person. We know a few things about them. Let's fast forward into 2050 when that Gen Z person will be around 60. And what will they be thinking and doing? Well, Gen Z attributes, unlike mine, they're true digital natives. They were born into a sea, an ocean that they were swimming in immediately of digital technology. Their brain will have developed differently because of the connections they make between their physical self and their digital world, their virtual world. They're born connected. We know already, these as young children, they can receive and send multiple sources of information rapidly. Just look at them. They get bored if they're not having multiple sensory input, dialoguing, texting, emailing, taking pictures of their food, putting it online. They think and communicate and consume information with images, not words. Anybody who has ever seen a child in grade school write a note and use grammar, they do pictures. They like teamwork. They're collaborative. They're exceptionally resilient, and they're realists. We also know that they're very open to technology. Some people think Gen Z will be the last fully human generation. That's because if you ask these individuals whether or not they'd be willing to have a device implanted into them to allow them to be communicating and connected continuously, they would readily do it. And this is the cyborgification of people that very likely will happen in the next 50 years. The neurocognitive enhancements that perhaps I might even want if I develop dementia as I get older. So I put this all forward for you to consider as we think about the history of scientific medicine, about how it's related to people, of course, and their generation, but also the technological innovations that have driven the wonderful advances that we have during the modern age, the golden age of medicine, from the light bulb to the cell phone, from no vaccine to a COVID vaccine within months of having the COVID pandemic. So I think by the year 2050, the advances in technology will be almost unimaginable. There will be this second wave of transformation in medicine. It will be related to this digital age, the big data that we're all seeing, that will be greater than that experienced by the founders of the golden age of medicine in the late 1800s, the William Oslers, the Flexners. They're going to have to develop new ways to educate, new ways to take care of patients, new ways to think about curing disease. So life seems to be changing very rapidly, and healthcare and research will be changing as well. And we will all have at our fingertips all the data about ourselves, not just our genome, but our transcriptome, our proteome, what we eat, how we exercise, how long we sleep. We should be able to determine, predict, prevent, ideally optimize our lives with all this data available readily to us. What would a doctor look like in 2050 going to the bedside of a patient? Would it even be at the bedside, or would it be a digital bedside? And would it be a consultation about your genome and the risk factors that you need to be knowledgeable about to avoid developing cancer in the future? I think that with the increasing volumes of data, the speed of analytics, and just as important, the generation of people with unique capabilities like Gen Z, that these future discoveries are going to be accelerated at a rate that we can only dream about right now, so that the science and the practice of medicine, I think, will continue this upward trajectory as we've seen over the last 100 years. And I personally look forward to it.